Hello everyone, this is Dr. Shivangi Tiwari, MCH resident in Department of Reproductive Medicine and Surgery, and today we will discuss stem cell therapy in infertility. After this lecture, we'll be able to answer the questions. These are: what are stem cells? What are the different types of stem cells? Why should we study stem cells? What potential therapies could they provide? And what are some of the challenges facing stem cell research? So, starting with the history of stem cell research. In 1963, discovery of renewing cells in bone marrow. In 1968, bone marrow transplantation between two siblings happened. In 1981, embryonic stem cells were isolated from mouse blastocysts. In 1992, adult stem cells were identified in human brain. In 2001, mouse embryonic stem cells were created using nuclear transfer technique. In 2006, discovery of induced pluripotent stem cells were done. In 2010, medical treatment using human embryonic stem cells for spinal cord injury, and in 2014, embryonic stem cells from adult stem cells. So, introduction. We all know that infertility has become a global concern, and the main causes of male infertility include impaired spermatogenesis and abnormal sperm quality. While if we talk about females, the main causes of female infertility are pelvic or inguinal surgery history, impairment of follicle development, ovulation disorders, ovarian dysfunction, damaged fallopian tube or fallopian tube obstruction, and so on. Now, application of ART for infertility treatment, it carries the risk of adverse perinatal outcomes and an increase in birth defects. So this stem cell technique, it can alleviate the shortcomings of these ART, and extensive preclinical and clinical trials are in the pipeline to investigate the safety and efficacy of stem cells as another promising therapeutic approach for the restoration of fertility. So what are stem cells? Firstly, stem cells can self renew. Self renew means अपने ही type में they can convert, like multiply हो सकता है. Second thing is they can differentiate into a specialized cell type. That is, they can convert into either into skin cells, muscle cells, or red blood cells. So what are stem cells? They can self renew, or they can differentiate into a specialized cell type. Now, based on the potency, there are four types. They can be totipotent stem cells, pluripotent stem cells, multipotent stem cells, and unipotent stem cells. So, when an oocyte is fertilized by sperm, there is a fertilized egg. That fertilized egg, it becomes a two-celled embryo, four-celled embryo. So till day 5 or 6 blastocyst, whatever cells are there in that embryo, they are totipotent stem cells. Then on the day 5, 6 or 7, 6 or 7 blastocyst, it contains an inner cell mass, and the cells in the inner cell mass are pluripotent stem cells. After this, uh, in the adult stage, in the fetal stage, and in the late embryo stage, these cells are multipotent stem cells. While some cells are unipotent stem cells, that is, they can convert either into their own type, like liver cells, pancreas cells. So, discussing about them, totipotent stem cells, they are the embryonic cells in the early stages, like two-celled embryo, four-celled embryo, and natural identical twinning is due to the division of an early embryo into two embryos. Pluripotent stem cells are capable of producing all the cells, tissues, and organs in the body, but not an embryo. And cells that are obtained from the blastocysts are pluripotent stem cells, mainly from the inner cell mass. So if suppose we want these pluripotent stem cells, so what we can do is we have to take an embryo, then we have to culture it till it becomes a blastocyst and we are getting an inner cell mass. This inner cell mass, we can take one cell, we have to culture it, then these embryonic stem cells, they can either convert into ectoderm, mesoderm, endoderm, or even germline cells also. That is, we can get even sperms or eggs also. That can help in the treatment of infertility. Next are multipotent stem cells. Multipotent stem cells examples are adult stem cells, cord blood stem cells, and cells that are obtained from the late stage embryos. They are capable of generation of several tissues, but not all the tissues. What are unipotent stem cells? So stem cells that are found in many organs like liver, bone marrow, testes. They serve as the reserve cells for the regeneration of appropriate tissue, and under proper in vitro or in vivo conditions, these cells can be coaxed to become other tissues of the body. Now, based on the origin of the stem cells, they are of five types. They can be embryonic stem cells, adult stem cells, induced pluripotent stem cells, spermatogonial stem cells, and the ovarian stem cells. Now, embryonic stem cells are pluripotent, self-renewable, but the problem is ethical issues with them. Induced pluripotent stem cells are pluripotent, self-renewable properties there. We have a wide variety of sources from which we can get these induced pluripotent stem cells, plus no ethical constraints. Mesenchymal stem cells have multispectral differentiation. They are easy to get. They are involved in the production of secreted proteins and they promote tissue repair. Now, talking about the characteristics of each stem cells. First are embryonic stem cells. Their characteristics are they are pluripotent. They have indefinite capacity to self-renew. They have the ability to differentiate into all the three lineages. They can differentiate into primordial germ cells in vitro, and subsequently they can undergo meiosis and give rise to male and female gametes. They have the ability to maintain the normal karyotype during growth. They play a crucial role in the repair of the damage and restoration of the function. Embryonic stem cell source is, as we have previously discussed, it's the inner cell mass of a blastocyst of a day 6 or 7 embryo. From where we can get these embryos? These embryos are usually the spare embryos, research embryos, or the orphaned embryos that are obtained from an infertility clinic. But the problem with the usage of these cells are ethical concerns, and that's why they are not so commonly used. Next are induced pluripotent stem cells. That as the name is suggesting, they are induced pluripotent. That is, we have done something to convert them into the pluripotent stem cells. So they are generated after reprogramming. Firstly, they resemble embryonic stem cells in terms of their morphology, in terms of the expression of surface markers, their telomerase activity, their capacity of differentiation to all the three lineages, and maintaining the normal karyotype during the growth. Plus, they are superior to embryonic stem cells in terms of, firstly, they are originating from the adult stem cells, therefore no ethical issues. Secondly, they are readily available. Thirdly, since we are developing them from the patient's own somatic cells, so there are less chances of immune rejection. So, these induced pluripotent stem cells, they have created a revolution in the reproductive medicine by generating oogonias from human pluripotent stem cells. But there are problems with with these induced pluripotent stem cells. What are these? Firstly, they have a teratogenic potentiality that results from reprogramming by induction with oncogenes like CMYC and nucleic acid integration. Plus, there can be persistence of residual epigenetic impressions, gene silencing, and genomic instability. And thirdly, there is a potentiality to exploit the embryos that are generated from the gametes that are developed after this reprogramming. So, suppose हमें induced pluripotent stem cells चाहिए. What we can do is um, we can collect the somatic cells, like we can collect fibroblasts, blood cells, muscle cells, adipocytes, or epithelial cells. We have to reprogram it by uh, we have to reprogram it on these genes, that is OCT4, SOX17, TFCP2L1, KLF4, TEAD4, and we can convert them into a person-specific induced pluripotent stem cells. Then there will be a germline differentiation and they can convert into human primordial germ cell-like cells. And then further we have to induce them with specific cytokines and growth factors to convert them either into oocyte-like cells or spermatid-like cells, and finally fertilization, and we can get genetically related offspring. In males, these induced pluripotent stem cells can be converted into a spermatogonial stem cells that can be further transplanted into testes, or they can be converted into spermatid to directly undergo IVF. While in females, these induced pluripotent stem cells can be converted into oocyte and directly go for IVF. Now, next are mesenchymal stem cells. They are defined as cells that have plastic adhesion properties. They express CD105, CD73, and CD90 as surface markers, and they can differentiate into osteoblasts, adipocytes, and chondroblasts. The Mesenchymal and Tissue Stem Cell Committee of the International Society for Cellular Therapy maintains it. Now, there are two types of mesenchymal stem cells, adult and fetal. Adult mesenchymal stem cells have reduced potency and abundance. They have a decreased rate of multiplication, decreased ability to differentiate into multiple lineages because of the age. While fetal mesenchymal stem cells, they have a higher proliferation rate. They are efficient in the differentiation to multi-lineages. They have strong immunomodulatory properties. Thus, they have augmented telomerase activity that makes fetal mesenchymal stem cells a better choice as compared to the adult mesenchymal stem cells. So, coming to what are the sources of mesenchymal stem cells? We can get these mesenchymal stem cells from bone marrow, from adipose tissue, menstrual blood, umbilical cord, amniotic fluid, placental tissue, salivary gland, and dental pulp. And if we want fetal mesenchymal stem cells, then during the first trimester, we can get it from blood, bone marrow, and liver. And after that, extra embryonic tissues such as human umbilical cord blood, Wharton's jelly, amnion, and placenta. Now, coming to the mechanism of action of mesenchymal stem cells. So, when we inject these mesenchymal stem cells into the body, they travel to the damaged ovary and they settle there to restore the ovarian function. So, there in the ovary, they release secretome, that is, they release cytokines such as vascular endothelial growth factor, IGF, and hepatocyte growth factor by their paracrine mechanism that leads to the angiogenesis, that is, formation of new vessels that prevent apoptosis as well as fibrosis and thus ameliorate the ovarian dysfunction. Then these mesenchymal stem cells, they differentiate into oocytes or supporting follicular or stromal cells, but how they do it is unclear. Plus, they have immunomodulatory effect by interaction with the immune cell. Now, when we inject these mesenchymal stem cells into the damaged ovary, they release cytokines or growth factors and they can help in the restoration of ovarian function. Plus, they have a role in endometrial regeneration as well. Next is coming to the ovarian stem cells. In 2012, White and co-workers isolated ovarian stem cells from the human ovarian cortex by using the expression of the stem cell specific markers. In Rick, हमें बचपन से पढ़ाया जाता है that it is the prenatal number of oocytes are there, prenatally जो हमें oocytes मिले हैं that is there, after birth there is nothing, मतलब जितना भी oocyte आपके पास है वही रहेगा, वही नंबर डिक्रीज होता जाएगा. There is but by using these ovarian stem cells, the identification of these cells, they contradict the dogma that only prenatal folliculogenesis is possible in females, because very low number, that is around 0.0145% of the total cell population in mouse ovary that is there, that declines gradually with age. Plus, these cells require a prolonged duration of differentiation in vitro culture that makes it difficult as compared to the male counterpart. The therapeutic implications are we can use them for the restoration of fertility and giving birth to live offspring in an age-associated infertility, plus in cases of premature ovarian failure in childhood cancer survivors following exposure to chemotherapy. Now, coming to the spermatogonial stem cells, spermatogonial stem cells are very small number in testes. Plus, they are very difficult to recognize so that we can isolate and culture them. Various biomedically active factors, they have been used for in vitro induction of potential stem cells into germ cells. These are retinoic acid for proper timing in the initiation of meiosis, CYP26 inhibitor for the control of meiosis through modulation of the STRA8 gene, testosterone for the potential release of stem cell factor to induce the germ cell differentiation, then forskolin is added to promote proliferation of germ cells, and there are leukemia inhibiting factor to keep gonocytes alive, and they are not so frequently used. Now, coming to the mechanism of stem cells, what are the mechanism of stem cells? So, firstly, they help in immunomodulation by regulating the Treg cells and producing the associated cytokines. They help in angiogenesis. They promote angiogenesis. They help in regulating the mitochondrial function by upregulating the mitochondrial pathway-related genes, and they restore the ovarian function. Uh, they have their property of induced transformation and their property of anti-inflammation by downregulating TNF alpha, interleukin 1 beta, and interferon gamma, plus their antifibrosis property by downregulating CTGF in ovaries and uterine tissue, their property of enhancing the follicular growth and anti-apoptosis via protecting granulosa cells from apoptosis through the PI3K AKT pathway. Now, coming to the application of stem cells in infertility. In male infertility, we can use them in cases of azoospermia, aberrant spermatogenesis, oligospermia, asthenospermia, severe teratospermia, while in female infertility, we can use them in cases of premature ovarian failure, polycystic ovarian syndrome, in uterine adhesions, and thin endometrium. And how are they going to work? That we have already discussed. Via promoting angiogenesis, by differentiating into primordial germ cells, by releasing exosomes and paracrine factors. So, the common types of female infertility issues are polycystic ovarian syndrome, Asherman syndrome, premature ovarian failure, and aberrant endometrial function. So, suppose हमारे पास कोई इनफर्टिलिटी की पेशेंट है, थिन एंडोमेट्रियम है, एशरमैन सिंड्रोम है, डैमेज्ड एंडोमेट्रियम है, व्हाट वी कैन डू इज we can collect menstrual blood. In menstrual blood there are adult stem cells that we can inject, or either we can take an endometrial biopsy. It is a proven fact that in the basal layer there are stem cells in the endometrium. So we can take an endometrial biopsy. From that we can get endometrial mesenchymal stem cells, and they work via angiogenesis, pro-proliferation, and anti-apoptotic and immunomodulation, and they help in the regeneration and repair in the of the damaged endometrium. Other options we have is we can collect stem cells from the bone marrow, that is bone marrow derived stem cells. We can collect stem cells from the umbilical cord or adipose tissue, and they all help in the regeneration and repair of the endometrium. Now, what happens after injecting these endometrial cells in the endometrium? So, see, when we inject these stem cells in the endometrium, there are two things happen. First is जो stem cells हैं जो हमने इंजेक्ट किए हैं, firstly they trans differentiate into the endometrial stem cells. तो हमने जो भी टाइप के stem cells इंजेक्ट किए हैं वो trans differentiate होके firstly convert हो जाएंगे endometrial stem cells में, plus जो already endometrium में stem cells होते हैं, that is stromal stem cells, endothelial stem cells, epithelial progenitor cells, उनको जो हमने stem cells इंजेक्ट किए हैं, they are going to activate the endogenous endometrial stem cells. Then they will cause the secretion of the paracrine factors, that they will do the immunomodulation, angiogenesis, antifibrosis, anti-apoptosis. Finally, they will do the endometrial regeneration via these process. So they will improve the endometrial receptivity and implantation. Finally, restoration of fertility. So this is a review article that was published in 2020, and they have shown that, see, this is the spiral arteriole, and they are saying that around the spiral arteriole there is a stem cell niche, and in that there are endothelial, epithelial, and the stromal endometrial stem cells are there. Now, coming to the germ cells, सपोज कोई हमें जर्म सेल्स चाहिए, कोई अजूस्पर्मिया का पेशेंट है या फिर POF, premature ovarian failure के patient है, and we want germ cells. What we can do is, we have three options. Either we can collect from the early embryoblastocyst, we can collect an inner cell mass that are pluripotent stem cells, and they can be converted into primordial germ cells. Second option is we can collect the embryonic stem cells. These are also pluripotent stem cells, and we can convert them into primordial germ cells. We can culture them outside. Third thing is we can take tissue sample like blood, skin, urine. We can reprogram it and convert it into an induced pluripotent stem cells, and then we can convert them into primordial germ cells, and we can get sperms or eggs. See, this is a if when we inject these umbilical cord mesenchymal stem cells in a case of premature ovarian failure, they work the same manner, that is anti-apoptotic, anti-fibrotic, angiogenesis effect, and an immunosuppressive effect. Plus, they are easy to collect and affordable also. So we can use these human umbilical cord mesenchymal stem cells in cases of premature ovarian failure. Another option is we can collect bone marrow stem cells from, usually it is collected from the hip bone. Around 120 ml of blood is collected from the hip bone. Then it is processed in the laboratory, and it is centrifuged in a machine. Then that machine will, after centrifugating it, it will separate the RBCs, WBCs, and platelets, and it will give us stem cells that we can inject into the patient's endometrium or ovaries. So case report that is claimed that this is the first baby that is there after the autologous stem cell therapy in a case of idiopathic premature ovarian failure named Zena. This is a case report that has claimed that this is a world's first baby with ovarian autologous stem cell therapy in a perimenopausal women of age 45 years. And this is an Indian study. Indian. Now, coming to PCOS, how it can work in PCOS. See, what happens in PCOS is because of the ingestion of glucose and saturated fat, it triggers mononuclear cells, and they secrete pro-inflammatory cytokines like TNF alpha, interleukin 6, and interleukin 1 beta that subsequently mediate insulin resistance and hyperandrogenism in PCOS. And patients with PCOS are infertile due to the poor quality of oocytes. Th1 response of PCOS patients are usually significantly higher. When we inject human mesenchymal stem cells, they can suppress human Th1 response that could influence the internal inflammatory environment in PCOS patients. Now, the common types of male infertility issues are oligospermia, teratozoospermia, asthenospermia, azoospermia, and varicocele. Now, if we talk about application of stem cells in male infertility, we can use them for non-obstructive azoospermia. Spermatogonial stem cells, they have a self-renewal property. They can differentiate into haploid spermatids, and they finally undergo maturation to convert into spermatozoa. Following are the clinical trials that are underway on the injection of bone marrow derived mesenchymal cells to the ready testes of azoospermia patients. Now, if we talk about the probable application of stem cells, it has been seen, these things are under research, that people are claiming that we can use these stem cells in the management of endometriosis. After injecting muscle derived stem cells, these can help in the vaginal reconstruction and in cases of erectile dysfunction as well, these cord blood stem cells. Next is, what are the mode of administration? How we can inject these stem cells? We can directly inject them into organs. We can do the systemic administration that we do in case of hematopoietic stem cells. So when we inject them, they colonize the organ and tissue, or we can do the direct surgical placement. What are the methods of installation? We can do it ultrasound guided. We can do it laparoscopically. We can do it hysteroscopically, or we can do it via intra-arterial catheterization of ovarian arteries, or a combination. Now, there are possible clinical challenges with the usage of stem cells, and these are safety and efficacy. So, how much these stem cells are safe and efficacious, it is under research. And due to the particularity of the disease and the treatment plan, most of the studies are one-arm and sample size is small. So, the data is So the data, whatever we have, they are not convincing and they need further clinical validation. Plus, there are ethical issues with the usage of stem cells. They have potential side effects. So, when we inject stem cells, they may trigger an immune response and an immune rejection as well. When we inject mesenchymal stem cells, they are associated with a transient fever and an adverse event at the administration site. When we use adipose tissue derived stem cells, they may activate clotting that when exposed to the blood, and there is an increased risk of thrombosis in patients treated with stem cells. So whenever we are injecting adipose tissue derived stem cells, anticoagulants such as heparin and anticoagulant, they are recommended to prevent thrombosis. Plus, stem cell signaling is closely associated with the development of cancer, reproduction, and treatment resistance. These are the national guidelines for stem cell research given by ICMR and the Department of Biotechnology that were published in 2017, and the most important part that are related to the clinician I'll discuss in very short. So this guideline classifies stem cell research into permissible, restrictive, and prohibited areas based on the ethical and safety concerns. It outlines the responsibilities of researchers and institutions in obtaining approvals and ensuring informed consent, safety, and oversight for stem cell derivation, manipulation, and clinical applications. Their aim is for the prevention of premature commercialization of unproven stem cell therapy and generation of new knowledge based on sound scientific rationale while addressing all the ethical concerns. Now, what are the responsibilities of investigators or institutions that are using stem cells? So, institutions that are involved in basic research or clinical trials, they should constitute an institutional committee for stem cell research, which should be registered with National Apex Committee for Stem Cell Research and Therapy. We have to ensure the confidentiality of the human donors. Biological material can be procured only from the clinics or hospitals that have IEC, and all the medical professionals that are involved in clinical trials, they should have a valid GCP certification that has to be obtained from the agencies such as CDSA or the online courses that are conducted by National Institute of Health USA. An institution or laboratory that is developing or processing stem cells for human use, they should obtain an NABL accreditation for lab. And the cells or cell-based products that are used in trial, they should be processed in a CDSCO certified GLP and GMP facility. Now, what are the therapeutic uses of stem cells? So, currently there are no approved indications other than hematopoietic stem cell transplant and anything and therapeutic. If we are using stem cells other than the approved indication for the therapeutic use, then it should be conducted only in the form of clinical trials. Then coming to the stem cell derived secretome. So what are secretomes? When we culture stem cells, then it in the culture medium they release growth factors, cytokines, chemokines, extracellular matrix proteins. So if we want to use that secretome, so before using that also the data regarding the pharmaceutical properties, quantification, the cytokines, preclinical and clinical studies, they have to be submitted to CDSCO, and based on the data submitted, approval for use will be granted on a case-to-case basis. And as of now, only umbilical cord blood banking is permitted and licensed by CDSCO. And others के लिए it is not available. So here take home message is mechanism of action of stem cells are their multidirectional differentiation, their angiogenesis property, paracrine stimulation and immune regulation. There is a role of stem cells in endometrial and ovarian regeneration. An institution or laboratory that is developing or processing stem cells for human use, they should obtain an NABL accreditation for their lab. Only umbilical cord blood banking is permitted and licensed. So these are my references. थैंक यू। अगर आपको मेरी वीडियो अच्छी लगी देन प्लीज लाइक, शेयर एंड सब्सक्राइब, एंड इफ यू वांट एनी वीडियो ऑन एनी टॉपिक प्लीज डू टेल मी। थैंक यू।